Hey everyone, thanks for being here again. Today I want to talk to you about an anxiety condition which is, again, something I'm all too familiar with, which is Obsessive Compulsive Disorder, often shortened to OCD. When I say OCD, one of the first things that you're going to think of is something along the lines of having to wash your hands 50 times a day, or Monica from Friends, who had to have everything completely clean and spick and span. And unfortunately, it is because it is so widely shown in comedy shows and things like that as a funny little quirk that someone has, the actual truth of it is entirely misunderstood. Because OCD isn't a fun little quirk. Sometimes some of the compulsions can be funny to an outside observer, but if you actually suffer from OCD, it's a very different story. Because OCD itself is not that having to wash your hands, or having to have everything in straight lines and right angles, or having to clean everything. That is the compulsion part of the disorder. What it actually is the compulsion is a result of intrusive thoughts, the obsession part of the disorder. And what intrusive thoughts are is where a thought will come into your head that will cause an anxiety reaction. It's usually something absolutely horrendous. I won't go into my personal situation on this in this video. I will cover that in a later video. But it usually involves some form of violence or, as I say, horrific situation occurring, and not necessarily just to the sufferer, to the sufferer's friends or family, or in some cases, even wider spread. And the way that sufferers get rid of these thoughts is by performing a ritual, which is the compulsive action. An example can be, you've heard the rhyme, step on a crack, fall and break your back. It's a little kid's rhyme that kids sing as they're going down the street, or used to in 1960s movies, as they're going down the street, not stepping on any of the cracks in the pavement. Now, to someone with OCD, it could be a case that you believe, or the thought comes in that if you actually do step on a crack, that you will somehow end up suffering a spinal injury. And so, in order to make sure that doesn't happen, you will avoid the cracks in the pavement. And sometimes the thought doesn't even have to be directly linked to the calming ritual, to the compulsive action. It could be along the lines of the thought of breaking an arm. Somehow something will happen and you'll break an arm. And the action you perform to calm this could be flicking the light switch several times until it feels right. Frequently that is a set number of times for people who do have the compulsion with light switches, and yes, that is a real thing. And to take it to an extreme, sometimes the thought is just something terrible will happen. You don't know what it is, you just get a feeling of dread, a foreboding, an anxiety reaction to the thought that something will happen, and so you will perform the calming ritual to dispel these thoughts. That is what obsessive compulsive disorder is. Intrusive or obsessive thought, compulsive calming ritual, and if you don't perform that ritual, or if you're in a situation where you can't perform that ritual, that's when anxiety starts to rise and panic attacks occur. I am going to give you one specific example which is safe for this video. People who know me, who have seen me in games of cards, will know that I shuffle 3 times. I will riffle in multiples of 3. If I go to 4, then I have to go to 6. If I go to 7, then I have to go to 9, and so on. And the reason for this is because when it comes to cards, if I don't shuffle like that, then I will be accused of cheating, and someone is going to beat me up for it. So I shuffle and shuffle and shuffle, and that multiple of 3, there, no one's going to accuse me of cheating anymore. And in my case, as a result of this, I actually find the act of shuffling calming. I use it as a calming, cathartic, sort of Zen meditation almost, in that if I'm starting to feel anxious, I can get out a deck of cards, shuffle, 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 and I may well start to feel better. One of the cruelest parts about it is that I know that if I don't shuffle like this, it's not actually going to happen, but the problem is it's an intrusive, obsessive thought. I can't get rid of it normally. It is stuck in there until I shuffle. And if something happens that means I can't shuffle like that, for example, I'm going along and I lose count, then you can guarantee that an anxiety episode or full-on panic attack is coming. And that leads me on to my next point, that a lot of people who know someone with OCD, they think it is just that quirky, compulsive action that they just see, oh, someone's got to have their pencils and everything perfectly straight and perpendicular. Let's just mess with them. Let's twist that one a bit. Ha ha ha, look, they've straightened it. Let's just twist it again. Oh, isn't that funny? Every time I twist it, they have to straighten it. And no, I'm sorry, it's not funny, because what you are doing there is you are subjecting someone to the anxiety and panic attacks that they're trying to avoid. You are exacerbating a situation where they already feel that something horrendous is going to happen. So please, if you see someone performing a quirky ritual like that, don't mess it up for them. It's not nearly as funny as you think to the sufferer. Like I say, I have shuffling cards in multiples of 3s. When I do that, a lot of the time, people try and make me lose count. You know, I'll be thinking, they're thinking, right, 1, 2, 3, and someone will go, that was 4. That was 2. And yes, okay, I know you think that's funny, but what you're doing there is you are making me fear for my physical safety. I know it's not actually in danger, but you are making me feel like it is. And it's the same for all sufferers. Someone who's worried that they may have left the gas on, if you say to them, "Oh, you're sure you turned the gas off?" what you're actually doing there is quite possibly convincing them that they're going to be going home to a burnt down house. Or if someone has to check the locks repeatedly, and you say, "Oh, you sure you're locked up?" you're convincing them that they're going to be going home to an empty house because they've been burgled. It's the same with everything that an OCD sufferer does. It's not a quirky, funny little ritual. It is something they are doing because they don't want to feel like this terrible, terrible, terrible thing is coming their way. And sadly, a lot of sufferers just accept it. A lot of people think that, oh, it's beyond TV, so no one's going to understand it. Or, you know, if I say anything about it, are they going to think that I'm just overreacting and it's actually nothing? Maybe I am overreacting and it's actually nothing. Well, no, it's not. You're not overreacting. It's not nothing. It's something that's making you feel terrible. Cognitive behaviour therapy can help you with it. It helped me for a while until blah, 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 incident. Talk about that later. So do try and seek treatment for it, because there are treatments out there. But that doesn't mean that you have to put up with people deliberately playing on it because to them it's a funny joke. Don't get angry at them though, because it is just down to misunderstanding. Because it's featured so prominently in comedic works, they think it's a joke. So explain to them, say, look, I know you think you're being funny, but OCD is not actually like that. What you're doing here is making me feel like I'm literally in danger. And explain to them what OCD actually is. Give them the short and ugly version of it if you want to, you know. Tell them, look, I am doing this because I think I'm going to break a leg if I don't. And in you undoing it and making me worry about it, you are actually making me feel incredibly uncomfortable. Please stop doing that. Of course, you don't actually have to use that explanation. If you can think up a better one for it that gets it across more eloquently and succinctly, and I am damn sure you can, because I've been having a lot of trouble with wordsing today, then go ahead with that. But don't let them continue thinking that it's just a funny little prank they're playing, because otherwise they're not going to know it's wrong, they're not going to know what they're actually doing, and they're just going to keep doing it until it has a disastrously detrimental effect on your mental well-being. See, now this is just something that I'm just starting to learn to do now. I mean, I've had this for many, many, many years, and my friends have played on it for a long time thinking that it's just a funny joke. And I've never actually explained to anyone what they're actually making me feel when they do it. If someone does it to me in the future, that is something I'm going to start doing. I'm going to, explain, look, you're not actually being funny to me here, you're making me feel bad. Please don't do it. Well, again, I've talked on and on, probably without saying anything of any value this time, so I'm going to leave it there. Thanks for watching, guys. I will see you next time.